Hi, good morning, ma'am.
Good morning po.
So, before doing the assessment, we must gather all the appropriate equipment first, such as tuning fork, pen light, gloves, watch wrist with second hand, and the otoscope. So, ma'am, my name is Arjun de los Reyes, your student nurse for today from LPU Cavite po. For verification po, may I know your name po?
My name is Yvonne Martin Casano,
Okay po. Birthday po.
June 20, 1998,
Age po.
24.
Okay po. So, ma'am, the focus of this assessment is your ear and hearing po. Wherein that requires to touch you po. Is it okay to you, ma'am?
Yes po.
Okay po. Gagawin po natin tong assessment na to para malaman po natin kung may ear infection po kayo or any ear abnormalities po. Makakapag-cooperate po kayo sa akin by telling me the honestly po kapag may tanong po ako. Now I'm going to perform hand hygiene to avoid microorganisms and bacteria. And I'm going to close these curtains for you privacy. Now, ma'am, I'm going to proceed by asking your history related to your ears po. May family member po ba sa inyo na may hearing problem po?
Wala po.
Sumasakit po ba ngayon yung ears niyo po?
Medyo
Okay po. May tinitake po ba kayong medication po ngayon?
wala po.
Okay po. Komportable na po ba kayo sa posisyon niyo po?
Oo na.
Okay po. Now I'm going to put the gloves before the session. Okay. Now, ma'am, let's start assessment. First, I'm going to inspect your oral health for color, symmetry in size, and vision. Okay, ma'am. So, for ma'am, the color of your ear is yellow-brown, which is normal naman po. Symmetrical naman po ito dahil hindi naman po kalakihan yung isa po at kaliitan po yung isa. And nakaposisyon naman po ito ng tama po. Now, next po, I'm going to palpate your oral health for texture, elasticity, and tenderness po. Now, mamahakan ka na po. Po, sa kabila po. Po. So far po, ma'am, your oral health po is moisture enough naman po, which is normal. Fear naman po ito. And wala naman pong tenderness or panlalambot. Now let's proceed to inspecting your external ear canal for cerumen, skin lesion, pus, and blood. I'm going to use pen light to see. Wait po. Kabila po, ma'am. So far po, ma'am, I see a presence of cerumen, which is normal naman po ito. Its color gray and flaky po. And I don't see any sign of skin lesion, pus, and blood po. Now, ma'am, I'm going to proceed to visualizing your tympanic membrane or your eardrum using otoscope. Since we don't have otoscope po, we're going to assume po ng otoscope po. Kabila po. Okay po. So far po, your tympanic membrane or your eardrum po is color pearly gray po and translucent, which is normal naman po. To assess your response to normal voice to. I'm going to whisper at ulitin niyo lang po ito, ma'am, kung ano po yung narinig niyo po. Happy birthday. Ano po ito? Happy birthday.
Happy birthday.
Okay po. Sa kabila po.
Happy New Year.
Okay po. If the client has difficulty in hearing, we may proceed to different tests such as watch-wrist test and the tuning fork test. Let's do first the watch-wrist test. Now, ma'am, sabihin niyo po sa akin kung naririnig niyo po ang tick po ng watch ko po.
Okay.
Dito po.
Okay po.
Dito po.
Okay din po.
Dito po. Okay po. Sa kabila po, ma'am.
Okay po.
Dito po.
Okay.
Dito po. Okay po. So, we're done in watches test. Let's proceed to tuning fork test. So, in tuning fork test, we have two components of this test. We have the Weber's test and the Renee's test. First, we are going to conduct the Weber's test. So, now we are going to conduct or do the Weber's test first. First, we are going to strike this tuning fork at the back of our hand. Then we're going to place the vibrating tuning fork at the head or the forehead of the client. Ma'am, sabihin niyo po sa akin kung nag-stop na po ang vibrating tuning fork po at kung narinig niyo naman po ito.
Okay.
Okay po. Narinig niyo po ba ito ng equal po?
Yes.
Okay po. In result po, in Weber's test po, normal naman po ang inyong test po dahil narinig po ng both ears nyo po. So now ma'am, let's proceed to Renee's test. So in Renee's test, we are still going to use this tuning fork. We are doing Renee's test to compare the bone conduction and the air conduction tone. Now ma'am, I'm going to strike again this tuning fork and I'm going to place this vibrating tuning fork at your master process. Then tell me po ma'am if the vibration po or the sound or tone has stopped po. Okay po. Now I'm going to start the tuning fork. Yeah, please to your master process. Okay po. Okay, sa kabila naman po ma'am. So, in result po, I observed that it is normal po since the air conduction is twice longer than your bone conduction po. Okay po ma'am, so tapos na po ang assessment. Thank you po sa cooperation niyo po. Now ma'am, I'm going to document your findings po. So far ma'am, you don't have any sign of hearing problem po. And kanina po medyo hindi nyo lang po narinig yung whisper test po natin. So ma'am, this assessment that we conduct today will be confidential between you, me, and the physician. That's all po. Thank you for your cooperation po.
Okay.
Thank you po.